Stephanie, and today I'm going to be conducting a bedside evaluation. There are two parts to this eval. The first will be an oral mechanism examination. I'll be looking at the structures of your mouth. And then the second part will be a food trial, which we will be trying 4 different textures of liquid and food to see if you have a proper swallow. Do you have any questions before we start? No? Okay. So the first thing we need to make sure is that the patient is sitting at a 90-degree angle. There are no anterior secretions. There are no lumps or scarring on the face or throat. Now what I want you to do is hold your breath. Just hold it for 6 seconds, all right? Ready and go. Perfect. Excellent. I also forgot to note that her breathing is quiet, it's not audible, so that's really good. Now I'm going to be looking at the structures of your face. Your face is symmetrical, we had said that. I need you to open your mouth, very good. Now I'm going to actually be looking in your mouth, okay? Very good. Your teeth, your facial pillars. Uvula looks good, soft palate, hard palate, your lower teeth, stick out your tongue for me. Perfect, excellent. Everything looks wonderful. Now we're gonna be looking at your jaw. So just open and close your jaw for me a couple times. Perfect, very good. And now what I'm going to have you do is I want you to try and open your mouth, but I'm going to be putting some resistance with my hand, all right? Very good. Now I want you to close it for me. Leave it open, now close it. Open it again, now close it. Very good. Excellent. Now we're going to move your jaw from side to side, just your jaw. Try not to move your lips so much. Like that. Perfect, excellent. Now we're gonna do like if you have an underbite, just kind of protrude your lower jaw forward. Very good, excellent. Now we're gonna be looking at your lip function. So now I want you to purse your lips, pucker, very good, and smile, very good. Now I want you to fill your lips with air. Good, proper seal. All right, now we're going to have you hold the tongue depressor in between your lips. Very good. And now I have to check both sides, all right? So we're gonna do this side. Very good. It's kind of funny, right? Excellent, very good lip closure. Now, what I want you to do is we're going to check your tongue, and I want you to just stick your tongue out. Very good. Now I want you to lateralize it from side to side, kind of meet the tongue depressor. Very good. Now I want you to elevate it, so kind of try and meet the tongue to the depressor. Excellent. Very good. Now I want you to pretend you have something on the roof of your mouth, like peanut butter when it gets stuck up there, and with your tongue sweep it off. But you're going to start from the front of your mouth to the back like this. Excellent, beautiful, perfect. Okay, and we already did tongue to nose, tongue to chin. Now I want you to lick your upper lip. Lick your lower lip. Good. Now I want you to move your tongue side to side, but leave it in your mouth. It kind of creates like a little ball. There you go. And push my fingers. Push as hard as you can. Very good. Excellent. Now I want you to pretend you have something here. Oh, there you go. Like you're looking. And the top part too. Very good. Now what I want you to do is I'm going to have you say some sounds. You're going to say the same sound over and over again, like this. Pa, 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 for 10 seconds. All right? Ready and go. Perfect. Excellent. Now I want you to say ta 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 for 10 seconds, and I'll tell you when to stop. Perfect. And the last sound is ka 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 for 10 seconds. Ready? Perfect. Now we're going to combine all three sounds. So it's going to sound like this. Patika, 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 patika for 10 seconds. All right, I'll tell you when to stop. And go. Patika, 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 patika. Perfect. It got tricky at the end, right? All right. Now we're going to be moving to your soft palate. All right. Now I'm going to push your tongue down, and I just want to have you say ah for me, okay? Ah. Good. Again. Ah. Great. Excellent. Now I'm going to be checking your gag reflex. I know. So I'm going to slowly push in the tongue depressor further back until we get a gag reflex, okay? Slowly. Slowly. Perfect. That was fast, huh? I know, that's the uncomfortable part. I know. Now I'm going to kind of sweep the side of your tongue. Okay, just touch it very lightly. And on the side that you feel it, I want you to lift your hand. Okay. Does that make sense? Okay, just open your mouth, stick your tongue out. Good. Stick your tongue out a little more. Perfect. Excellent. I have to trick you a little bit, right? Now I want to check your cheeks. The same thing. I'm sorry. The same thing. Whatever side you feel it on, that's where you lift your hand. Okay? Perfect. I had to trick you. Alrighty. Now I want you to give me a nice, strong, clear ah, just for a few seconds. Ready? Go. Ah. Very good. Now I want you to take a deep breath, okay? And I want you to hold that ah for as long as you can. Okay. Ready? And go. Ah. 22 seconds. Very good. Your voice kind of broke there for a little bit.
Yeah, he jumped on me.
Yeah, that's all right. I understand. Now we're going to see if you can modulate your pitch. So we're going to start off like normal and then raise our pitch like this. Ah! 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 Very good. Now I want you to do a nice strong cough for me like this. Perfect. Now I want you to clear your throat, not cough, clear like this. Like if you have a frog in your throat. Perfect. Okay. Now I'm going to check your